This poster explores findings from a survey of UK healthcare professionals in relation to the preparation of patients for amputation surgery. This is the first survey of its kind to be conducted within the UK. The survey was hosted online and disseminated via social media and through the special interest groups of the Vascular Society. The survey was open for 1 month in total. Preparation of patients for amputation surgery has received limited exploration in the literature around amputation care, but we know that amputation can be a life-changing experience for patients and have a whole host of implications in relation to their psychological well-being as well as their quality of life. Care for patients undergoing amputations has also been criticised, and we know that improving information for patients that are undergoing amputation is being seen as a priority research area to help improve the experiences of care for patients. It's therefore important that we understand how patients are currently being prepared for amputation surgery, as well as exploring ways in which existing care could be improved. This survey is part of a wider study which is funded by the National Institute for Health and Social Care Research. The Improving Psychological Preparedness for Amputation Surgery Co-Designing, Implementing and Evaluating Patient-Centred Care Pathways study aims to explore how preparation for amputation can enhance patient experiences and outcomes, and will work with patients and staff to develop new pathways and resources to enhance their preparation and therefore care. The survey is part of a scoping phase of this project and received ethical approval from De Montfort University in Leicester. In total, 121 respondents from a range of healthcare professions replied to the survey. In total, 116 responses were analysed. 1 did not provide consent, and 3 were excluded as they were clinicians who were retired and therefore did not meet the inclusion criteria of currently working in the UK in a healthcare setting. The responses were analysed using descriptive statistics as well as thematic analysis for the free text comments. The approach of Brown and Clark with their reflexive thematic analysis was used for these free text comments. The survey found that psychological preparation of patients was seen as being extremely or very important for the majority of healthcare professionals. The only group to identify preparation of patients being somewhat important were consultants and surgeons. The majority of professionals that we surveyed, 63%, did not feel that preparation is currently done well, and therefore felt that there were opportunities to improve and enhance the preparation that patients currently receive. Most patients do, however, get the chance to meet with professionals involved in their care before their surgery and some written information to help them understand what they are consenting to and the experience of their surgery. So we do know that patients are receiving some preparation, but most professionals feel that this preparation could be improved. We asked questions in the survey around the time taken to gain consent from patients for their surgery and to discuss the risks of surgery with them. The mean was 34.6 minutes. This, however, reflected a huge variability in the time spent on taking consent that were reported to us, with some professionals reporting that they spent 180 minutes taking consent and discussing risks with patients. 40% of those that responded did, however, say they spent between 5 and 15 minutes taking consent and discussing risks with their patients. We asked around the disposal of limbs after amputation and whether that was discussed with patients, and most respondents reported this was not discussed before surgery. Some did, however, note that if religious factors were thought to be indicated in a patient's care, then they would discuss the disposal of limbs after the amputation surgery with those patients. This reflects the wider literature in which the disposal of limbs is not routinely discussed with amputation patients and limbs disposed of through medical waste, regardless of patient preferences around the management of their body parts. We also asked who was best placed to help with the preparation of patients who are having amputations. And allied health professionals, specifically physiotherapists, occupational therapists, and prosthetists, were identified as the best placed professional groups to help prepare patients for surgery, with nursing staff and surgeons being seen as lower in the ranking of who was best placed to prepare those patients. We also asked questions around what type of information that patients should receive in order to help them be prepared, and a whole wide range of options were chosen by our respondents. The two that came out top were around the immediate outcomes of surgery and what patients could expect, as well as around phantom limb pain and its management. Both of these could be seen as more physical aspects of and outcomes of amputation surgery, although information on grief and loss and psychological well-being after amputation were also ranked highly within that question. In terms of the future improvements that healthcare professionals identified, included the need for greater integrative support for patients, the need for more consistent information to be provided, including more standardised material to enhance the quality of care, and that expectations of both patients and staff needed to be managed better so that the outcomes from surgery were not surprising or disappointing to either party. A number of barriers around improving preparation of patients were identified, and this is included around the cohesiveness of multidisciplinary teams and cross-team working, as well as the time and space in order to deliver those resources. It was also noted that individual care was needed and that standardisation may be challenging in terms of preparation, as patients are having amputations due to a range of reasons, and the individuals will have different thresholds for the amount of information that they might want to receive before their surgery. Therefore, whilst preparation of patients undergoing amputation is seen as important by professionals, it's still perhaps under-considered in clinical care. This survey has helped us identify possible areas and opportunities for improvement of preparation. Greater focus on preparation would potentially benefit patients, but also help professionals further manage patient experiences of care by being able to offer the information that patients might desire, and to help manage their expectations and focus them on the outcomes and rehabilitation aspects after their surgery. Thank you.